Hi everyone, my name is Daneshmand and welcome to the Love and DNA series. As you all know, I started these series to highlight individuals or organizations who are doing something positive in our society. And of course, we're going to do a segment on Miracle Babies, an organization that was started in 2010 by me and a lot of volunteers to provide financial assistance to families who have sick newborns in the neonatal intensive care unit. Well, by 2020, with COVID, we started transitioning what we're doing, and we started providing transportation services, which you'll hear about from our executive director and other team members. But I'm very excited also for the launch of a new program called My Brain and My Baby, because what was missing with Miracle Babies, the transportation service, was we were making sure every mom is united with their sick newborn. But what was missing was the mental health of a mom. As we all know, depression, anxiety is on the rise, and with COVID, unfortunately, these numbers have really made a lot of patients struggle. We are, as obstetrician gynecologists, as perinatologists, we're obligated to screen our patients when they're pregnant and immediately in the postpartum period. But there's no one to send them to because psychologists, therapists, they're inundated by the number of patients, by the number of referrals. There's stigma associated with it. There's health plan authorization issues. There's money. Some people only charge cash. If you have Medicare, Medi-Cal, some people don't accept those insurances. So I'm honored to be here with Sheila Kubota, who's the director of My Brain and My Baby, the program that we're so excited about, that we're going to be hopefully launching in May of this year in 2022. Sheila, tell me a little bit about My Brain and My Baby.
It is going to be a free therapy service for high-risk mothers who we know that high-risk pregnancies are a higher risk for perinatal mood and anxiety disorders, also known as maternal mental health disorders. And so they are going to be the ones that we focus our services on. So we're going to be doing some short-term therapy and then some group therapy and a lot of education out into the community, because we're finding that there are a lot of people who do not know about maternal mental health issues. And several people in our short time doing some community needs assessment here locally in Southern California, they don't even know that it starts during pregnancy. I think so many people have that misconception that it's just postpartum, and then also that it's just a few months and then it goes away. And we know that that is not the case at all, particularly with the population that's already being served by Miracle Babies. The NICU, that's a huge risk factor for getting maternal mood and anxiety disorders. But then coupled with high-risk pregnancies, any other traumas you may have experienced in the past, if you've had mental health disorders in the past, all of that and so many other factors can just increase your risk for any kind of maternal mood or anxiety disorder. So there's so much work to be done, and we're lucky that you guys have been able to find funding to have this service be free to the moms that we'll be able to provide.
Miracle Babies helps parents in a few different ways. We have our transportation program, which ensures parents get to the hospital to be with their hospitalized infants. We've also now expanded that program to include moms with complicated pregnancies, getting them to their high-risk appointments, and cardiac babies through the first year and a half of life, getting them to their very frequent cardiac appointments to make sure that they're getting the care that they need. We also provide care packages to parents that have babies in the hospital. We do miracle hours pre-COVID, and we hope to get back to those in the near future, where we take a catered meal and do a crafting activity with parents.
And that's wonderful, because I know how hard it can be for the families to get a hot meal in the middle of their time in the NICU. And it sounds almost like a little support group.
Absolutely. Parents want to stay close. The intent of Miracle Hours is twofold. It's to provide them with a hot catered meal, so they don't have to worry about buying hospital food. They've already got added unanticipated expenses to worry about. And we're creating a keepsake for them that's part of their NICU journey. And we invite in a NICU social worker or a NICU nurse that can also help facilitate some therapeutic conversations, and again, in a very non-threatening manner.
I think that can be great to also have an opportunity for them to get a chance to meet each other, because it's not easy to meet other people in the NICU.
Absolutely. The way NICUs are designed now, they're nice and that they include private rooms, but it's challenging to as you said, to meet people. And how do you start up a conversation with a stranger, although you're living the same barrier of, having a baby in the hospital? It's not natural. And again, you meet friends and have people to rely on and make some special connections.
And it sounds like sometimes that's occurring naturally as well in the transportation program.
So organically, we've seen, moms connect with one another in the van. So we've got some moms that are getting close to going home with their baby. And then we've got new moms that are just starting their journey. So, they are able to provide support to one another, especially to the newer moms.
How has the transportation program helped you?
It's helped a lot. My wife is still working full-time, and it lets me go to the hospital without having to rely on her to drive me. It takes the pressure, essentially, off me trying to find a ride or calling Uber to go see my baby. I feel really bad when she's in the hospital all by herself and I'm at home. So Miracle Babies having a ride to go see her is like life-changing and life-saving. I don't like being at home and just knowing that she's there at the hospital and I could be there for her, but I can't get there. So it's just helped in that sense that it's made it a possibility for me to go see her. First ride was a little awkward for me. I'm not very social. But the more and more we go together, it's the same group of people that live around the same neighborhood. So you get to hear, like, how's your baby doing? Are you having good days, bad days? And the good days are good, but the sad days are sad. But it's just like a little community. And then if you run into each other, like in the hospital, you're like, oh, hey, how's it going? How are you? So it's really nice. But then you do get to meet other people in a similar boat, even if they're not in the same hospital as you.
We've also seen some real special things happening where moms need certain things and other moms are able to help provide tangible items. Parents, also are able to get items from us as well. So we have transformed our conference room essentially into a baby store. So we have the basic essentials for parents to come into our office and collect items. We have baby clothing, formula, diapers, a lot of starter items. So we always encourage parents to give us a call, see what they need, and they're welcome to come in. Social workers also know that we have these items available, so they often send families our way as well. And we are very close to a few of our big local hospitals, so it's convenient for parents as well.
So it's free for families, all of these items?
Absolutely. In 2020, in response to, supply chain issues, people being furloughed, we started doing drive-through diaper distribution. So Miracle Babies is now distributed over 1 million diapers.
1 million?
To over 8,000 families. And we will continue to do that. Just again, now with gas prices, commodity prices increasing, the need is there. And the nice thing about our distributions are, it's almost a mini community event within itself. We have AMR Ambulance Company doing car seat safety checks. We're distributing feminine hygiene products, again, wipes,
and all for free.
Literacy kits, exactly. And so we're so thankful for our community partners as well to support our distributions. We do them in Orange County, and we're gonna start doing distributions in Los Angeles as well. We're very excited to finally be able to address moms that have perinatal stress and anxiety. So we're gonna be launching a mental health program in spring of 2022. We're gonna be launching My Brain, My Baby. That's our newest program, and My Brain, My Baby will be providing perinatal mental health support to moms with complicated pregnancies and our NICU moms. And it's gonna be all via telemed and another free service and a much needed service. Mental health has been an issue for many, many years, and it impacts us all. And COVID has brought that to the forefront. And we are just so happy that we're now able to implement this program, and thankful to our founding sponsor, Natera, for believing in us and believing in mom's mental health. And we're just thrilled to be able to offer this free service.
So nationwide, the studies have indicated that about 800,000 women are suffering from this, and only over 75% of them are not seeking treatment. I think there's several issues there at play. Some you already mentioned, stigma. People who are able to do screenings don't know what services to provide. I think for mental health, it's still scary for people who are focused more on the medical side. I think it's always hard to open that can of worms of mental health if you don't know what to say to them or what services you can turn the family over to. So some just won't even go there, which is such a disservice.
It's such a disservice. And, I read 1 in 5 women are struggling with depression and anxiety. We have about 4 million Americans, pregnant, delivering each year. So 800,000, women are struggling with depression and anxiety.
Dr. Craig, can you help everybody understand what a reproductive psychiatrist is?
Sure. It's a fairly new subspecialty in psychiatry. It's basically a women's subspecialty, and we deal with anything that's sort of at the boundary between OBGYN and psychiatry.
Wow.
So for me, I do anything from PMS, PMDD, pregnancy, postpartum, infertility, all the way to menopause. When I first came to San Diego and set up my practice, I was the only one doing what I do.
Okay.
And so women were really just thrilled to find me and to find out that there was a specialty just for them for these issues, because they had felt misunderstood and like there just wasn't anyone they could really see who, captured all of their worries and concerns and so forth. Since I did that in 1998, there have been many more reproductive psychiatrists come into town, and they are training a few. There's no official residency yet, but there's a program at UCSD where they have graduated a few residents with this sort of area of interest or concentration.
Okay.
And so it's really neat. It's really nice to have colleagues.
Yeah, I can only imagine.
Yes.
So immediately, I think one thing that we've identified is if you're able to talk to mothers about it during pregnancy, then just providing them the awareness alone. So lots of people can do this beyond us. Anybody listening can just do this, is knowing that there is a risk during your pregnancy and what to look for thereafter. So there are lots of studies that show just some intervention during the pregnancy can reduce the amount of perinatal mood and anxiety disorders postpartum by 33%. And so if we can just prevent them from even occurring, I think that's huge. So we're starting in the pregnancy with moms that we know to be a high-risk category with their high-risk pregnancies. And then with giving them some of the education about what to look out for if they're already experiencing those signs and symptoms, giving them that short-term therapy and support. And then we're going to be linking them to providers in the community if they need ongoing support, because we know that a lot of this will turn into something postpartum. And so we don't want to drop them there. We want to get them already into the services, connected with a provider so they have that support moving forward. And then hopefully be able to show some of the benefits of this program so that other people can replicate it and we can help others throughout the nation know, starting it during pregnancy, then that's that much less concerns that people are going to have to follow through with postpartum when there's already maybe a premature baby, already a baby with other siblings at home, socioeconomic status. There's so many things that can just increase the difficulties of mental health, and what that then does for the family thereafter is huge. And so we talked earlier about the 1 in 5 statistic of moms, and if you are of low socioeconomic status or a woman of color, it's 3 out of 5. So your likelihood is it's increased dramatically. And then during the pandemic, they've seen that it's tripled the amount of maternal health issues that have come up for mental health.
It's hard with my delivery being difficult, and me having to heal from like my preeclampsia, and then baby being in the NICU. It just felt really hard. It's like you have a baby, but you don't have a baby because she's in the NICU.
Yeah.
And you're in the hospital bed trying to heal from another thing. And then once you start healing, it's like, well, your baby's still in the NICU. Are you really like a mom? Are you really a parent? Because the nurses are taking care of your baby and you're just kind of like helpless.
Yeah.
So I had a lot of anxiety that first week, is like, and then my milk wasn't coming in. So it was a lot of like anxiety and stress. It's like, I can only do one thing, and that's make milk for my baby, but I can't even do that. And then it was just a lot of, it took a toll.
Yeah.
In addition to everything that was going on.
What are some of the common fears that you see for mothers that are coming in around medication or around getting help for their issues?
Well, I think women have a lot of fears, and they've probably changed over the years, but there's always some hesitation about seeing a mental health professional if they've never seen one before. There's a bit of stigma attached, and it just really changes how people see themselves if they think that they have something related to a mental illness. And so there's a lot of kind of adjustment and comforting that I have to do. And then there's a lot of questions about the safety of using medications in these situations, the safety for mother, the safety for baby, safety in breastfeeding, because ideally you'd like to use the same agent all the way through. If you
From
can.
pregnancy all the way
through to breastfeeding. So, there's a lot of that.
Yes.
I read that we have, a significant number of women struggling with this. Less than 25% are actually getting treatment.
Yes.
And this accumulates to about a $14+ billion cost annually to the US.
Yeah.
We always talk about epigenetics, we always talk about DNA and the environment, and I always explain to my patients that, the environment for your child when you're pregnant is mom. All right? How does depression, anxiety impact the fetus and the newborn?
Oh, I wish it didn't, but it does.
Yeah.
And there are so many aspects of the baby's development, small for gestational age, so they're going to be smaller size, and then premature birth, right? Which is a huge piece of what Miracle Babies is about, is helping the families during that time. So small for gestational age, premature birth, and then the long-term consequences of the moms that have unaddressed mental health issues. They're not going to be able to bond and attach with their baby. The babies are looking to us for those cues, us as in the parent, the mom, and if they're not able to get that, then that stunts their brain development and then their developmental potential longfold. They're at higher risk for health issues. There's more frequent visits to the emergency department for an anxious mom who's just not sure and doesn't have the confidence. The children are more likely to have mental health issues, and then the cycle continues, because we know mental health issues just span so many different aspects of your life. You're not able to hold a job, you're not able to be present, and then the kids have issues with behavior in school. You're not able to just meet some of those basic needs if it gets to a debilitating point. And I think there's a lot of nuances with mental health where sometimes people just don't even realize it's there until it gets to a point where you're having, psychosis, or you're having such extreme panic attacks that you can't go out, you can't help your child learn something new. And so there's just such far reaches in society that this can impact. And if we can prevent that from even occurring, then the baby has that much more developmental potential thereafter and can break some of the cycles. And how important do you think it is for families to hear that there is struggles in the NICU, and you're not the only one, and it's important to get screened and get help?
I think it's huge. It helps you not feel as isolated. Every baby's case is different, every parent's case is different, but just knowing that you share something, even though it's not the best thing in the world, but the baby's alive, and it's a struggle, it's a roller coaster, there's ups and downs, and just knowing that a lot more people experience it and you're not alone is very helpful.
I know that as adults, when we seek therapy, whether we're depressed, whether we're stressed out, or any kind of midlife transition or crisis that we're facing, a lot of times therapists ask about our childhood years. I think there needs to be a lot more focus on the pregnancy period and the immediate time after that, because a lot of things, unfortunately, that all the negative things that we encounter is a lot of it has to do with those early childhood years, because again, the DNA is also very impressionable. That's why, again, the Love and DNA series, right? DNA in very early stages of first weeks of life has already determined the personality, the hair color, you know, our sexual orientation, all those things. But the love and nurture of a mom and a parent and a caregiver is crucial to that child's development. It changes the function of that child's DNA. So we can actually reduce many of these issues that we see with our children by making sure that, again, a mom is present mentally there. So that's why, you know, what you're doing is so important. I have so much respect really for the line of work you do and your compassion and respect towards our patients.
I think I've heard from Postpartum Health Alliance, they want moms to thrive, not just survive.
Exactly,
right?
exactly.
What do you think is one of the most important things for a mom to know if she is suffering about getting help, especially when there maybe are other people in her life that are not as understanding about mental illness and what that means?
Well, I would say it's that she's not alone. That is the motto of Postpartum Support International. You're not alone. There are women, you probably know women who have had this problem and they just haven't told you, or there may be women in your family who have had this problem and it just hasn't been shared, because it is common enough that it's around.
Whether it's like just talking to your spouse or talking to your parents or somebody at the hospital or a stranger on the internet.
Yeah.
I think that would have been helpful for me to let myself do that and let myself become even more vulnerable than I already was.
Yeah. And then you can start your path towards healing, right?
Yeah.
And then being able to be that much more present for your baby.
If you're already feeling some of these symptoms of irritability, just lack of self-worth and self-confidence, which I think is so easy for a mom, even an experienced mom, somebody with higher education, all of us are at risk for this. And then that increases the risk of the dads or the other partner, or the non-birthing partner to have mental health issues as well. And then the children, right? So it just keeps, it's kind of like a pebble in a pond. That ripple effect is just exponential. And so I think if people know, it doesn't mean you're a bad mom. It doesn't mean you did anything wrong. It's just part of the combination of a ridiculous amount of hormones coming through your body, the previous trauma you may have had, and then, you know, lots of different situational aspects, but it's not your fault and it's preventable. I think people don't remember that this is 100% preventable and you can get help and it's okay.
I think, you know, a lot of times, you know, women feel pressured because it's a happy time. They just had a baby and you're supposed to be happy and there's no reason you should be depressed. But, you know, again, we need to break the bubble that people are living in and, you know, expecting everyone's going to be happy, and we need to address the issue. And I think a lot of this is preventable, as you mentioned. And we can also, again, how do we make sure that we create a very healthy life for our future, for our children? Mama's got to be well. One last thing I just want to tell you, as you mentioned again, mom. Miracle Babies, the name is Miracle Babies, but it's really about the mother. We want to make sure mom makes it to the NICU, to the ICU, to be with that child. If mom is not there, that child doesn't do well. We want to make sure that mom is mentally feeling well again, so she can be there with her child or children.
Not only do people not realize that there is maternal mental health issues from pregnancy and then thereafter it continues, there's a lot of focus on the child, which is wonderful. But again, like you're saying, if we don't have that mother and the focus on the mother, which I think is easily forgotten at times, we wouldn't even have to be working on redirecting the child and some of their acting out and some of the different therapies that we then, I feel like that's the solution to something, but the mental health piece is the prevention. And so if we can prevent that and save $14 billion and all of these cyclical issues and the things in society that occur thereafter, then it's just huge. So if programs are able to get funding for doing maternal mental health, then they'll focus on that, right? So if you get the funding for it, you can focus on that and you can prevent all of these things long term.
We're appreciative of our donors. We need money. We need people to advocate for us. We need to hopefully expand these services, not just in California or in San Diego, but in every city in this country of ours, because as you mentioned earlier, the numbers of patients who are struggling with maternal mental health disorder is unfortunately very high. I want everyone to remember it's the number one underdiagnosed disease in pregnancy, and we're not addressing it well enough. So please get involved.
We are always looking for community support. People can visit us at miraclebabies.org to learn more, to provide financial contributions, to volunteer. We appreciate time, talent, and your treasure. So thank you.
Yeah, it's been great. Like, Miracle Babies is a great company, and I'm glad that it exists.
Thank you for watching the Love and DNA series on Miracle Babies and My Brain and My Baby, a new program that we're launching for maternal mental health. Please visit our website at www.miraclebabies.org. Visit our Instagram page for My Brain and My Baby and Miracle Babies, and also our Facebook page. I appreciate you very much. I look forward to seeing you more often with the Love and DNA series. More to come. Please follow us. Come and join us. Raise your voices for all women in this country who are struggling with maternal mental health issues. Thank you.
Please fund us so we can provide free services.